All right, happy Wednesday and welcome to Back Talks with Dr. Sean McWilliams. So great to have you here. And if this is your first time, welcome. So glad to have you here. Make sure you say hello in the comments. Let me know where you're from, and if you have a question, I want to answer that for you because we're going to be talking about the most common questions that my moms are asking about dealing with spinal pain, especially with a bulging or herniated disc. So what I thought I'd do is take the top 3 or 4 that I've gotten this week and answer them for you. So when we're finished today in the next few minutes, that you feel empowered again and feel like you have answers that make sense to you. You feel informed, and I can help you navigate this type of issue so that you can get back to being the mom that you deserve to be and that you want to be in your heart, right? So without any further ado, let's get on with it. So hey, would love to say hello to you as well. We always have a little contest to see who's going to be first, so we usually always wait for someone to come on. But while we're doing that, let's get into some of the questions that my moms have been asking me who have been suffering with bulging or herniated discs. And number one question is what is a herniated disc and how does it happen? So I'm going to switch cameras. I'm going to show you this cool close-up here. So the first thing you got to do is understand just what a normal disc is to begin with. Because if you don't quite get that, it's a little harder to understand everything. So I'm going to show you this model here. And what you're looking at right here is you are looking at a intervertebral disc. Has 2 parts. It has this inner part called the nucleus pulposus. It's like a jelly if you've done any homework on it. Then you have these outer parts called the annulus fibrosus, and you can see if you look really closely, you see those rings? So it's like layers of belt after layer of belt after layer of another belt after layer. It's like having like 15 belts on your pants to go out somewhere. The chances of them falling off are probably pretty slim, right? So the belts keep the jelly on the inside where it's supposed to be. So that's healthy, is how this is thumbs up. Let me show you the difference in a disc that is injured. So now we are looking at an injured disc right here. This would be the definition of a bulging disc. And I'm going to show you one more model of that as well, and I think it'll all make sense to you. And what we're looking at here is, again, you can see this red part, that's that jelly, but that jelly now, because the outer rings, those belts have torn, is allowing the jelly to start to migrate outward from the center of the disc. And that is called a bulging disc. And we don't want those. And the reason that we don't want those is because a bulging disc, when it tears, the outer 1/3 of the disc, let me get back to here. So the outer 1/3 of the disc, so this part sitting out here, has all your pain receptors in them. They're called nociceptors. And so when you get tears, just like if you were to tear yourself, you fall down, you cut yourself, you start getting oozing from the skin, the body starts going through a healing process. That same thing happens inside of our disc. The problem is there's a tremendous amount of pain receptors that sit in the outer 1/3 right here, and they get irritated really bad, and it can be a very big source of back pain for people. So please don't underestimate or not give enough value to a bulging disc. These can sometimes be really painful, even if that jelly hasn't fully gone out of the disc. Now, what happens if all the belts tear? Well, if all the belts tear, then you go from where the jelly's still inside, even though it's migrated out, to this, where now you can see the jelly has come out of the disc. And we don't want that. And I'm going to show you another model of that. It might help it look a little bit more clearer for you. So again, we're going to go to this big guy right here. Try to get this in good focus for you. Okay, so this white structure right here is the disc. You have your nerve branches that come out right there for you. And so when a disc is healthy, it should be the same exact shape as the bone above and below. If the disc starts to bulge, because those belts are tearing, the disc can start to do this and bulge out like that, and that is a bulging disc. If it continues to go past that and the jelly starts to migrate outside and all the rings tear, then you start getting this occurring where that jelly starts to come out and can start to push on that nerve or spinal cord, and that is called a herniated disc. So if the jellies come outside, it's a herniated disc. If the jelly's still on the inside, even though the disc is torn, that's a disc bulge, okay? And that is a normal disc where it's back to its normal shape and size, okay? So I hope that was a great explanation for you. So how does it happen? Number one, trauma. Most common type of injury to the low back is usually a fall onto our butt. That's usually the number one trauma that's going to happen to the disc. Number two is repetitive motion or injury. So if you keep doing something repetitively, that can tear your disc as well. Number three, an unlevel pelvis. Because when we walk, that means that every time you take a step, if your pelvis is unlevel, it drops down. And what's that do to the disc? Well, let me show you what it does to the disc. When the pelvis drops down on one side like this, the disc does this. It torques, just like that. Okay? And when that disc torques, it tears that disc. Right? So we don't want this torquing on the disc, and that's exactly what happens when we walk and one side drops down, the vertebrae has to turn, and the disc torques in the process. And over a period of that torquing for you, and that is, what activities should you avoid? Well, if you have a herniated disc, you should avoid walking, because if your pelvis isn't perfectly level, and most people's aren't, you're going to keep having that torquing. And that jelly, it literally is like jelly you'd put on toast or inside of a jelly donut. It will squirt out on you. So if you keep going weight bearing when you walk, or especially, God, if you run or you're in the gym working out, you're going to keep pushing that jelly out of that disc, and it's almost really hard to fix that. Please, moms, I've been doing this for 25 years. I've helped so many moms get their life back and be the moms they want to be. But let me tell you, the ones that don't do this stuff, they re-injured their spines usually in 2 to 3 years, and you got a whole new issue to deal with, because now you got probably scar tissue in there because you didn't heal right. Please give yourself the grace to let your body heal. Have a talk with your significant other or your partner if you have one, and let them know you need to rest and you need help, and it's okay to ask for help. I know you're super mom. I get it. I admire you for that, of course. You can get back to being a super mom, but you got to take care of yourself first, all right? Just like on the airplane, put your oxygen mask on first, then put it on your child's. So that's question number one. Let's see, what are the symptoms of a herniated disc? Well, they are quite common. I wrote an ebook for you if you'd like to read about it. It's about 5 pages, but it's packed full of great information. You can have it probably read in about 15 minutes. It's going to answer every one of those questions for you, but typically common symptoms are going to be muscle weakness. If it's in the neck, muscle weakness of the shoulder, arms, hands, or fingers, or pins and needly sensation, or numbness and tingling going down the arms, hands, or fingers, and usually into particular fingers depending on what level it is in the neck. In the low back pain, usually at the bottom part, the 5th vertebrae and disc is the most common wear out. L4 is the second one. So that's usually going to be the area where most people have symptoms at. If the nerves are starting to degenerate and die, you can typically going to feel stuff going down into your buttocks, legs, or feet. If you download my ebook off of our website at drshawnmcwilliams.com, and that's DRSEAN McWilliams.com, you can learn a lot more about it, and I can answer a lot more questions for you. So I hope you'll go do that. And let's see, let's answer one more question for you today. Let's see, we talked about the symptoms of herniated disc. How does it happen? How about how long does it take to heal a herniated disc? Well, believe it or not, if you do the right approach to it, which an intermittent traction done to help create a decompression to the disc, just like when you use a turkey baster, right? And you go to put that turkey baster in the gravy to suck it up. You can take a disc a lot of times, and just like a turkey baster, you can help suck that disc material back into that disc. And that's what intermittent traction does when it's used properly and you do it properly. There's a lot of wrong ways to do it, but there's right ways to do it as well. And I teach that in a course, if you're interested in that, called Disc University. So Most people, believe it or not, after their first treatment will usually have some form of some symptom relief, and that's a great sign. So we want to slowly suck that disc material back in to the disc, and then let the rings, the outer part of the disc, start to heal itself. Usually takes about 12 weeks on average to get the disc to be pretty healthy. After that, I give you recommendations on what to do as well. So that's usually your timelines. In 2 years, you can usually have a very healthy disc again, if you just do the right stuff. Okay, so I hope that you found this informative. I hope that you're going to want to share this. If you got someone that you know, that you love, who's suffering with bulging and herniated discs and isn't quite sure which direction to go, I get calls all the time. You can book a call with me at bookings.drshawnmcwilliams.com, booking.drshawnmcwilliams.com. And we can set a consult up. You'll fill out a small form for me and give me some a lot of things that I need to know so we can have a real conversation about what's happening with you. And we'll just sit down and talk on a Zoom call, say hello, and see what's going on with you, what you've been trying to do, has anything working, and if it's not, perhaps see if Disc University would be a great fit for you. And if it is, I would love to share it with you. We worked really hard on it. And if not, and if I think there's a better option for you, I'm going to let you know that as well, okay? And I'm going to tell you, help guide you and navigate you. So I don't want you to feel alone. So no matter what, it's going to be a win for you, okay? And Marisa, thank you so much. There's the link you can go to, and it goes directly to my calendar. You can see some cool testimonials as well on there of other patients, and set a call up with me. I get booked quite quickly, obviously, because I'm not charging for this right now, just because I want to help you moms start to feel better and start being the mom that you want to be again, okay? And start having a great time with your kids again. So go book a call with me, and let's see if we can shine some light on your situation for you. Normally it's $195, just so you know. That's what I charge to my office. But right now, for March, I'm doing it complimentary for you. So would love to chat with you. So make sure you take advantage of that, okay? Hey, and if I've added value to your life, I hope you'll subscribe to our channel. Make sure you hit the little bell sign. It'll send you a notification every time that we do something to help make your life better. And we do it every single week here as well. So watch out for that. And I hope you'll share this with someone that you know could really benefit from getting these answers and perhaps maybe talking to me. So love and appreciate you. Thanks for being here on a Wednesday. It's a beautiful day here in Georgia. I hope you have an amazing day, and you have an amazing day because you choose to make it an amazing day. And that's how it works. So I will talk to you soon. See you next Wednesday. And make sure you book a call with us, please, so we can get you feeling better quick. All right. See you guys soon. Thank you.